Good evening, everybody. I'm Rishabh Satish, local officer for Council of Medical Education, Mysore Medical College. Today, with the local council of MMCRI SIMSA, bring to you the need of their workshop, Staying Sane as a Medical Student. So, before we get started, I would like to talk a little about this amazing organization. SIMSA, South Indian Medical Students Association, is a consortium of, by, and for medical students of South India. It was founded on 10th June 2020 when a group of passionate medical students came together, understanding the need for opportunity and exposure for South Indian medicos. SIMSA is recognized under the Government of India. All healthcare students studying in any year of their degree are welcome to come forth and become a part of this organization and be more. You can know more about us at simsa.in. So, getting started, mental health is as important as physical health to a happy life. But in today's society, especially in our country, there's still stigma associated with mental health issues. Talking about mental health is not exactly appreciated in everybody's households. So, did you know that 27% of medical students show symptoms of depression when screened for it? So, it's high time that we talk about this and address all the underlying problems. We know in the last year, all our lives have been dramatically affected by the pandemic, which has added on more and more stress into our already stressed out lives. Surely, our mental health will have taken a toll because of this. So, we have brought in an expert to talk more on this. Now, Deepashri, our local council head, will be introducing to you all our guest for today. Deepashri.
Good evening, everyone. I am Deepashri, and I'm the local committee head of SIMSA MMCRI Karnataka. So before we begin with the workshop, I just wanted to lay out some ground rules. So the question and answer event with our guest psychiatrist will be after Sir's presentation. To send in your questions, please type it in the Mentimeter link that's been provided in the YouTube comment section as well as in the WhatsApp group. The questions have to be relevant and please be respectful while typing out the questions. So our honorable guest for today is Dr. T.V Anilkumar. He is the professor and HOD of the Department of Psychiatry at the Government Medical College, Trivandrum, Kerala. Thank you so much, sir, for agreeing to be a part of this workshop. So we shall begin with the analysis of the responses we received from the survey form. We've received over 180 responses. Thank you so much for taking up the time to fill out the forms. The first question is, do you think the state of your mental health has an impact on your overall productivity? So as you can see, 98% have replied as yes, absolutely. And also the social interactions have reduced due to physical distancing. Of course, 74% have replied yes. So as you can see in the third question, the levels of our anxiety due to COVID-19 and its repercussions, with 35% being high anxiety, not able to focus on tasks on most days, 27% moderate anxiety, and 27% low anxiety, 8%, only 8% out of the 181 responses as not anxious. So you can see that you're not alone with dealing with anxiety in the responses that we've received. So you're one amongst the 181 people who believe that they are facing anxiety because of the COVID-19 and its repercussions. So as we can see here again, academic stress is the major factor which is affecting our mental health and well-being. So sir, could you please provide your insight on these statistics?
Yeah, and happy to see you all. Anyway, it's a great initiative that we are discussing mental health. I think more than mental health, it is emotional well-being. This anxiety is there all over the world, and because of the COVID, it has increased for doctors, all health professionals, and medical students also because of the impending that uncertainty about the future, exams, all these stress, and unable to attend the clinical postings and unable to attend the regular classes. So it is always when we face such pandemics, it's normal. This is the first thing we have to accept, that the feeling anxious or stressful during this pandemic or this unusual, unexpected situation is normal. It's a normal reaction. But when it affect your routine, your academic performance, or your daily activity, we have to take some action to reduce it. So that is what we are going to discuss. So instead of focusing on this anxiety and stress, we'll discuss how can we improve the well-being, the happiness part. So we'll come to the detailed discussion later. Please move on, Deepasri.
Do you envy the performance of your classmates and get stressed out or demotivated? Sometimes 47%. I think all of us have faced this situation. And how often do you talk openly about mental health with your friends or family? So it's very good that we see 35% as sometimes, but 33% as rarely is not a favorable outcome. So, sir, what do you have to say about this?
So regarding the second part, the sixth question, how often do you talk openly about your mental health? So that is the most important thing. So we have to communicate. Whenever you share your distress or worries, that will come down. If you share your happiness, it will double. So sharing is very important. We should, whenever we face such difficult situation, if people are around us, there are people to communicate and share our the problems or give support, or that social support is the most important thing. Mother Teresa once said that the loneliness is more, there is a most major problem in this century. Previously, these major illnesses like leprosy, the stigmatizing illness were there, but the loneliness, so that's a major issue, especially in the COVID time because of the pandemic, lockdown, the quarantine, and even because of the illness, we may be isolated in a room for a long period. So getting connected, even though there is a social distancing is advised, but connecting through other social media, connecting our minds, that's very important. So getting connected is very important. We'll discuss again later.
Thank you so much, sir. Very well said. When we share our happiness, it doubles, and when we share our sadness, it reduces. So the seventh question is, how open would you be to discuss your mental health with a professional? 42 have answered that they would be very comfortable with discussing their mental health problems with a professional, which is very good. So we can move to the next slide.
So here one important point is this mental health, we should consider this is part of total health. So for a human being, there should be physical health, mental health, social health, and also the fourth dimension is our meaning of life, or some people may say spiritual health, or you are searching for a goal, or identity and all. So physical health, when we discuss, especially even in medical colleges or in the medical profession, we discuss health as only physical health, but there are other dimensions, mental health. Actually, the mind is there in the brain. I usually use this model of the brain to teach mental health to our students and also the public. We work with school students, teachers, and we run an NGO to educate about mental health. There we use this model because there is a lot of stigma attached to mental health. But if you connect, mind is a function of the brain. So it is a part of the most important part of our body. So the healthy brain gives a healthy mind. So it is part of our brain, out of the body, and also the environment, society in which we live, family, your friends, your college, your environment. So the physical health, mental health, and social health. So the total, that sort of holistic approach is very important. Then these problems should be communicated. So there is a delay. If there is a delay, or if you are not communicating these mental health issues, that may result in complications like suicide, substance abuse, unhealthy way of managing stress. So that these are major. This is increasing now, and even game addiction. No. So we have to address these issues by preventing, or you have to plan for prevention of this problem, because treatment at the later stage may be a little difficult. So we have to prevent it, so that the communication and seeking help at an early stage, that is a message. Thank you. Proceed, Deepasri.
Yes, sir. So healthy mind equals healthy body. So like sir said, the unhealthy coping mechanisms to get away from this stress is being exhibited by a lot of us. So drugs, 3%, adult videos, 18%, binge eating, 35%, smoking, excessive alcohol consumption. I'm glad that none of us, being 108 out of the 181, are resorting to any of these unhealthy coping mechanisms. So And so the 10th question we've already addressed. So coming to the WHO Well-Being Index. So sir, could you please explain this to us?
Actually, as I said earlier, all over the world, now the thinking is positive mental health, well-being and all. Because always there is a stigma associated with the psychiatry, mental health and all. So that's why people are reluctant to communicate the mental health problems. Even simple anxiety or depression may not be communicated. So we have to think from the other side. So if there is an anxiety, the other side will be confidence to communicate or confidence to face things. So instead of depression, we have to think about happiness. So, or well-being. So we need, all of us need well-being. Well-being, maybe the mental health well-being, we can communicate easily as emotional well-being. So there should be a physical well-being, emotional well-being, even social well-being, and even educational well-being. We'll discuss in my slides also. So the WHO has come up with this well-being index, which is only simple 5 questions. So we'll come to the 5 questions, and your response we analyzed. Please show the response. Question number 1. Okay. So I have felt cheerful and good spirit. So you can see only 25, nearly 25, 26% only feel that they are happy. Or please show the scoring previous one. Previous. So they often, all the time. So 4th and 5th must be the better score. So next one. So we get a positive response for only 20 is 25 total. That 4th and 25, 26.
Yes,
Yeah,
sir.
26, correct. Exact 26%. So we need to improve. So our target is how to improve this well-being. So you forget about the stress and anxiety, and instead of focusing on the problem, we have to think or focus forward, move forward. So how can we improve well-being? So focus on that. So that we will discuss in the coming slides. Okay, next. I felt calm and relaxed. Again, this is actually a better response. Nearly 31% reported that. Yeah. So again, we should not forget that 70% not feeling calm and relaxed. It's natural that during this anxiety is there during this pandemic. Next. Next. Yeah, I have felt active and vigorous. Vigorous, actually, again, only 20%, exactly 21% only feeling active and vigorous. So physical activity, including that our sleep, appetite. So that's why we have to bring back that rhythm of normal sleep, taking food at the regular time, adequate balanced food, and exercise at least 1 hour per day. So especially for youngsters and at our age, at your age, the student age youngsters. So WHO recommendations are there. If time permits, we discuss the physical activity. Be active. Even physical activity will reduce your anxiety and depression. It will produce changes in the brain. It will improve the endorphins, positive, the so-called happy molecules like dopamine, endorphin, and when you go out and play with your friends, it will improve the connecting, the love hormones, even oxytocin and all. So the physical activity, being active, that's also important for both physical health and mental health. We'll discuss in detail. Next. 4th question is, I woke up feeling fresh and rested. Only again, I think 30, around 30, 32%, 31% total. 4th and 5th question. So getting up early, adequate sleep is very important for a proper function of the brain, to concentrate in your studies, in your next day activities. So minimum 8 hours of deep sleep and getting up fresh. So that's very important. So all of us should aim for that adequate sleep, because of the overuse of all of us are using this mobile and other social media and other internet game. Now some of the youngsters are going for game addiction, free fire. I'm running a child psychiatric clinic in Trivandrum Medical College last 20 years. We do a lot of community program for school students. So game addiction is the main big issue now, especially during this COVID time, because of there is no classroom regularly, not attending the regular classes, and they are going to online classes. So the children with emotional problems, behavior problems, ADHD, conduct, they are going to addiction. So we have to, so it will affect the sleep. So they will keep on doing the using the screen, and the sleep will be disturbed, and getting up late next day, and they are irritable, and it will affect the concentration, academic performance. So adequate sleep is very important. We'll discuss. Fifth one. Debasri. Yeah. My daily life has been filled with things that interest me. So again, we get a positive response only for 21%, 21.5. Okay. No, yeah. No, 21, 26. No? This is the total one. No? Yeah. WHO well-being index. This is analysis for the
whole form, sir.
All forms. Okay.
Yes, sir. So 15% of the people who took the form have chosen option 0, which is the most negative option out of all of them. And 21% option 2, 29% option 3, which is average score, and 19% option 4, and very low 7.9% of option 5.
Yeah, we get a 26, 25, 26 only. So 1/4 gives a better well-being. So we have to improve in well-being in others also. So that's a topic of discussion today. Okay.
Yes, sir. So now I hand over the presentation to Dr. Anilkumar, sir.
Let me share.
So you can go ahead and share the screen. Yes, sir.
I hope it is visible, no?
Yes, sir.
It's moving also. Okay. So the topic is coping with confidence and 10 tips for happiness or well-being. So I'll be mainly focusing on how can we improve the well-being index, or the emotional well-being, so that if you improve or concentrate on our emotional well-being or mental health well-being or positive mental health, automatically your physical health improves, your social health improves, and your even the spiritual health, or your vision for future, your goal, your motivation to reach goal, everything will improve if you get a. After all, we are all working for or living for happiness. Only that pleasure, no? Pleasure means there are changes in the brain. When we get something which we are looking for, when we feel happy, there will be a dopamine surge in our brain. So it is the dopamine surge which we are looking for. The unhealthy way of this dopamine surge is a drug addiction. So drugs will give more dopamine, and people will these youngsters are going to the immediate, instant high by using drugs. But if they go after these unhealthy happiness, the other normal activities like simple family, friendship, or sports, or even art, or other normal things which give happiness may not be appealing to them. So that will deteriorate in all the academics and all the social activity. So I usually, these are flowers from my garden here. So you have to be cheerful, happy, and enjoy life. So every moment you have to enjoy. This flower is called Thunbergia grandiflora alba. There's a violet varieties also there. So there is a say, wherever there are students, there should be a garden and library. So spend time with the nature, going out and enjoy the nature. That will also improve the well-being. So outline of my presentation is the importance of well-being and happiness, how it is connected to our life, and 10-point happiness program is a great dreams. There is an acronym for that. We'll discuss this great dream in detail, and some 10 daily activities which we can follow, and we can make a happiness calendar so that well-being will improve. So can somebody give an answer to this question? World Mental Health. Let it interact in between so that it will not be a boring one-way lecture. World Mental Health Day theme for last year, that is 2020. Please switch on. Is it possible for them to switch on the camera and answer the question? Diva?
So it's a YouTube live session. They're not on
yeah,
Zoom.
only these 100 Zoom participants are there, no? No, only few are there. Then some of you can give answer.
So
Yeah.
wasn't it move for mental health?
No, it is actually our topic, mental health for all. Again, positive mental health. That is a message. So investing, we have to invest more on mental health, and it should be accessible to everybody. So all of us, it is in everywhere we have to discuss mental health. It is not only for patients or persons with mental health problem. All of us need mental health. So as I mentioned earlier, this is a part of physical health, mental health, and social health together as a part of the health. So it's part of the health. Actually, we learn in WHO's definition for health. It's a not an it is an absence of illness, but it is the healthy mind, healthy body, and healthy society. So well-being from early childhood to youngsters and to elderly, the entire spectrum of life, the happiness is very important. So we have to work for that, all ages, the student community or elderly. So these are some of the questions we already discussed. This is the initial analysis. So only 24%, that only 1/4 of the medical students participated in survey are feeling this cheerful. So all of us are aware the stressful situation or stress is actually the reaction from our body when we feel something threatening outside. So it will affect almost all organs in our body, including your brain and other organs. It can produce a lot of medical issues. So the low stress from here, this is a graph showing an optimum stress. Optimum stress is important for our better performance. When stress increases during our exam, there will be gradual mounting of stress, and it is essential for reading more and getting doing more work, getting more references, spending more time in the library. So some amount of stress is important. But if the stress increases for a long period or a high stress, the performance will come down. So we have to keep that stress in a optimum level. So our psychological health or this so-called positive mental health will improve your productivity. So this is a picture which is showing, this is usually named as a black dog as a symbol of depression. Sir Winston Churchill, he used to get depression. So he called depression as a black dog pulling from back, and so we are unable to perform. And this is my family. This is an old photo. My wife is also working in medical college. She's a professor and head of the community medicine in another medical college. My elder son is doing medicine. Finally, he just completed a theory exam. So if you are stressful, the entire family will be stressed. So you have to be happy, or well-being is for your family also. When you, as a medical student, if you are stressed, your parents will be stressed. And as a doctor or in a future you become a professional, you have to be happy and healthy for your family also. So it is very important for our family. So the Evastrian team here, you can assess, one of you can say the, in a scale from 1 to 10, how will you rate your well-being or happiness? And how can you improve as a medical student? How can we improve? Those who are in this group can switch on the camera and discuss. Either Rishab or Vivasri or the other people are available in this group.
Sir, so I think that
please switch on the camera. I can't see you.
Scale right now,
Yeah,
it's somewhere close to 6 or 7.
Very good.
And I think the way we can improve this is probably sticking to a routine, forming a routine where we include the physical exercise and probably 20 minutes of meditation and 7 hours of sleep. So this is a very optimal timetable, which I'm sure that we'll make one day and then we'll scrap it the next day and we'll follow like 2-3 days and then we'll stop. So I feel like it's very important for us to keep at it and follow the timetable that we set.
Every year in the new year, we make a lot of resolutions and to go to the gym and the physical activity, and we fail to follow. So continuing the activities, that is very important. So this is to show the happiness index in the world. Do you know where India stands in this happiness index? This was, I think, data last year published. Rishabh, do you know where India stands in the order of after 147 countries? Where is our happiness? Huh?
Around 140 or something.
Yeah,
140th
140, lowest 10. We are here in the lowest 10, even below the Pakistan, Bangladesh, and all. So that's a sad status for our country. So we have to improve that well-being. And you can see I think Finland and other countries are with better happiness. So we have to work for our well-being and our well-being of the nation, well-being in the institution, well-being in the campus, well-being in the family. So it should be a message we have to communicate as a medical student also. So this is an algorithm. Are you happy or not? Yes, you continue. So keep doing whatever you are doing. As Devasri said, if she's 6, how can we improve to 7 or 7 to 8 is okay. So if she's satisfied or feeling happy, continue to do the work, whatever she's doing, like exercise or sleeping adequately. But if you're not feeling happy, all of us want, do you want to be happy? If you don't want to be happy, you continue your work. But we expect that we have to change. After all, we need happiness. So, but to get happiness, we have to change, make some change in your life. So I hope after this presentation, some of you will get motivated to make some change. When from small change, big things happen. There is a album on that. From little things, big things happen. Those are interested, you can watch. And I think in the Times of India, many newspapers discuss these issues: how to be happy, love, pets. These are usual discussion in the lay press also. And even now we have to think about even family, marital status is very important, relationship important, pets are important, environment is important, gardening, everything is important. But health is most important. So in COVID time, we have to think about our health. So the health, even people who are youngsters who are vulnerable for the COVID, they become the risk of complication is more if they are obese and they are taking alcohol and they are smoking. So a lot of behavior interventions are required to reduce even mortality in healthy situations. And even COVID also, we have to take a lot of behavioral, we call behavioral vaccines. These proper use of this mask and hand washing, social distancing, these are all actually behavior changes. So we have to think and use a brain for a proper healthy behavior to prevent unhealthy situation. So health is very important for a happiness or well-being. So these are slides we use to teach our school students. That's why we use these student symbols. So the well-being, there are letters in Malayalam also. So well-being, I usually use this triangle to explain that health: physical well-being, psychological well-being, and social well-being, your friends and institutions, and also the value or goal. This is the fourth dimension we usually ignore in our life. There should be a value, goal, meaning, your hobbies, your friendship, everything is important. It is not simply physical, psychological, or social. Your goal as medical students, we have chosen this profession to serve others because of our to empathize with others, to reduce the pain. So there is a great vision for all of us who are working in this. So we have to, in all the stressful situations, we have to work for that, our value, our goal. That's very important. So to go more details, physical well-being means physically fit, exercise, sleep, eating, drinking, water. Then psychological well-being means enjoying leisure activities, feeling emotionally or mentally well, focused. You should be able to focus in your work and being interested and curious about the world. And then you will become more interested in your studies and you will ask questions, you learn new things. Your social well-being mean getting connected to your friends, your family members, to the environment, regular contact with the loved ones. Okay, so if you are performing in this area, you can say you are in the green zone. You just imagine this traffic light model, green zone. If there are some environment in this physical well-being, you are not doing exercise, not sleeping properly, not eating properly. Most of the students, even medical students, skip the morning breakfast because of the getting up late, and to avoid getting up late into the clinics or classroom. Many of us may not get time to eat properly. So healthy or good breakfast is very important for our brain function. So the physical well-being important, and then emotional, and when sleep and all the other issues like getting disconnected. There are studies which show that if people who are using more time, spending more time with smartphone, there will be less interaction or less connected with your friends, and you may be unliked by your friends. So if there are some minimal environment, you are in the orange zone, you have to take steps to come back. You are in the dangerous zone, like very serious difficulty in sleep, and you are going for unhealthy techniques like smoking, alcohol, and you have to help your friends to come back to that green zone. So we have to think from a positive side. So you have to keep your well-being in the green zone. And also the environmental well-being is also important, like, and a campus should be green. You keep at least one plant inside your room, it will give some well-being. So we are doing some, I will show that slides in our, what we are doing in our campus. Financial well-being is also important. During this COVID time, many, especially the low socioeconomic status people, working class, very difficult to that going through a difficult time. There is no job opportunity, so financial issues will affect children, their studies and education difficulties. So the all well-being, all dimensions, we have to keep a balance. So it is very simple to be happy, but it is very difficult to be simple. Can anyone say who said this? Hello? Please guess.
No idea, sir.
It's Tagore, Rabindranath Tagore. So it is not, actually it is not costly or it is not expensive to be happy. This is an article I recently, I mean, this issue, actually the July issue of Indian Medical or IMA in our state, 10 ways to happiness. Recently, yesterday, I got the hard copy. So I am going to discuss this great dream, this 10 steps. Actually, we have started a workshop for children, children in the children's home. I participated today, and for 2 more days it is there. And we are trying to introduce this happiness program in our children's home, where children in difficult situation, orphans, they stay here. So this is very useful. Just remember, this is an acronym, great dream. Giving, G means giving, do something for others. That's what we are doing in our medical profession. Then relating, getting connected. These are common, simple things. There is nothing new actually. There's only repacking into a acronym kind of thing to just remember. Exercising, getting awareness, getting connected to the nature or living mindfully. There's a mindfulness. Trying out, learning something new. Direction, have a goal. Resilience, find ways to bounce back. So how to cope with this COVID time, difficult time. So how to manage stress, emotions. Look for what is good in your life. Look for positive emotions, your success, your happy moments with your family, friends, and all of us in medical profession. You are very good in studies, so you got a lot of success and came here. So you just remember about those positive moments. Acceptance. Be comfortable with who you are. We, all of us, there may be some challenges or some. We need not use the word problem or difficulties. There are things to improve. There are, all of us, there will be some skill and some special ability, but something may be there to improve. So we have to focus on those things. So what, anyway, we have to accept and live with that. And finally, a meaning of life. So be part of something. I will try to go into a little deep into this each topic and stop, and we'll go for discussion. Now it is 35:36. Okay. So giving means do something for others. caring for your neighbor. That giving may not be financial. This is a famous quote from Bible. Help to carry one another's burden. So carry. So that will reduce that feeling that others are there. Others are there to help you. So that will reduce that distress. This is very important. We here in our institute, we have started an organization called Manasa. This is called Mentally and Neurologically Ailing Person Self-Help Group. So it is a self-help association of recovered mentally ill person, their family members. This is a getting together and connecting. And we professional, I have been working as the founder, secretary, and we are supporting these patients for rehabilitation, support, psychoeducation, a lot of programs we are running in the community. And this is just to show that this is for an academic purpose. This is a hypothesis called adverse childhood experience, something like you learned in pediatrics, like Barker hypothesis. Obesity in childhood can produce cardiovascular disease in later life. Similarly, when stressful situation, adverse childhood experience can produce hypertension, diabetes, early death because of the high risk behavior, alcoholism or other. So neurodevelopmental, there will be changes in the brain simply because of the negative life experience in early childhood. So these are the things. So we started these children in institutions. So that is what I mentioned. We have started this happiness program in childcare institutions in Kerala, where the children are away from family. They suffer a lot. These children away from family. This is a recent publication, Lancet. It will affect their cognitive development, their physical growth, cognitive development, even attention. So the even simple physical space and food is not enough for the growth of our body. Even emotions, support, play activities, these are important for a proper development of brain. So if there is a stressful situation, early childhood, it will affect the normal development of the brain and neurons. So that's why we started this program in our institution. So giving something, this is a smart eye program we started today. This is mainly a life skill kind of program, and this is conducted there is a program called Our Responsibility to Children. We are running this program in 500 schools. Now started doing in these special homes with the help of NSS, National Service Scheme. I am working as a secretary. So our 15 first year medical students will be going and interacting with these children, and they will sponsor these children for next 1 year. So to encourage that, I think you must be aware that NSS should take a village to adopt a village for the community activity. So we are planning to adopt these institutions for our activity. Nirbhaya home, there is a children, girls who are abused, sexually abused. So our girl students will go there and sponsor or interact, teach them life skills and all. This is our plan. So helping others can boost your confidence, especially helping others who are not known to you, not your relatives or not your friends, a random kind of kindness. So there are studies which showed that. So you have to, because there is no time, I'm not going to these activities. We usually ask the participants an act of kindness. Somebody you have helped something recently and all. So the second point is relating, that is connecting to people. So getting connected. This is activity we usually the family. So eating together, emotionally connected to family, friends, spending time with family. We encourage children to spend at least 1 hour with family every day. Example, during the meal time, without switching on the mobile or TV. So it's a quality time talking together. This eventually get connected. So it's very important. So this is an activity we usually give to the students. Today also we gave this, draw a tree, and in the leaf they have to name write the names of who are all there to help you. So it's something like a gratitude. So it will improve your emotional well-being. Every day you can write in your diary, somebody helped you or you helped somebody, you did something for others. So this gives a pleasant feeling and it will improve your confidence also. This is another activity we give to children, ask them to write who are all there to help you. This will help in your COVID time. If there is you are isolated, who will help you to even bring food or go to hospital and all. This is my daughter sitting with a dog, our pet, Ladley. So connecting to the nature is also important. So there should be a garden and spend time with the nature. That will definitely reduce your stress also. This is my house. It is difficult to see house. Even gardening, pets are important. Even pet therapy is now recommended as a treatment for children with behavior therapy, and anxiety will reduce if you spend time with the and household activities also reduce it. Then the third point is exercise. So you may think that it is very difficult to go out and join a gym, but inside the room or outside in the campus or in the terrace, do some physical activity. Even for when these new generation things like even Zumba dance or some activity, at least for 10 to 15 minutes at a time, you can do 2 or 3 times per day. In between, you can walk or run and do something physically, be physically active at least 1 hour. There's a WHO recommendation. So our response is less, only 20% are feeling active and rigorous, 19%. So this was the risk for COVID death if there is obesity and poor physical activity. This is for doctors, I think. More risk if there is obesity, BMI more than 80 and physical activity less than 30 minutes per day. So physical activity, this is a WHO, 80% of the adolescents. Actually, you are all in the adolescent age group. Now the adolescent, the brain maturation may take up to 25 years. So we are in late adolescence. So 80% of the adolescents are inadequate activity. That is why the WHO has come out with this recommendation. We need this 15 to 17 years, 1 hour exercise per day. Even children less than 1 hour, 1 year need to be, they should be allowed to play in a supine or prone position, moving their limbs 30 minutes per day, 1 to 2 years, 3 hours per day, 3 to 4 years, 3 hours plus 1 hour moderate to severe activity, like that. Your parents also, you have to encourage them to walk or do some exercise 30 minutes per day for 5 days. So physical activity is very important for physical health and mental health. So these are the advantages of physical health. I need not stress on that. This is important. Even for physical activity will improve your psychological well-being, your anxiety, your cognitive function, your academics will improve if you spend time in physical activity. And screen time is a major issue now. Screen time is the most important factor which is reducing our physical activity now. So we recommend less than 1 hour screen, and before going to sleep, stop screen, all the screen for 1 hour, because it will, this blue light will reduce your melatonin secretion and it will affect the quality of. This is a WHO recommendation. Yeah, 11 to 12 years and all, they are recommending up to 2 years without, which is not affecting your academics. So teens who spend lesser time in screen, in the front of the screen, have better mental health. There are many studies reported. So screen addiction, game addiction is a major issue. And in our medical college and recent studies, I think 25 to 30, 40% are excessive. There is excessive use of screen. And the fourth point is awareness. Mindfulness is a new technique, getting connected to nature or concentrate on whatever you are. Mindfulness simply means non-judgmental acceptance or focusing, concentrating on the activity which you are doing. And there may be mindful eating, mindful walking. So whatever you do, be focused on that activity. So our report, that is only 30% are feeling calm and relaxed. So mindfulness, these are the deep breathing. You can do deep breathing. Is mandala, this painting, you must be knowing mandala printouts are, it is possible to take printout from the internet, and you can do the painting activity using the color pencil. Creative drawing, you can use the mandala calm down jar and mindful eating, all this. This is the mandala work I did with my daughter in a workshop recently. This is a mandala. This is available, so you can do it from, it's get freely available from net. On the wall, we have done it. So simple other things like a relaxation technique. These are 5 minute, 10 minutes simple techniques for relaxation, immediate relaxation, even before exam. If you do it regularly, if you are feeling anxious before exam, you can do it. That anxiety will come down. That these are the five or six steps you teach. You simply sit in a chair, close your eyes, or tighten your facial muscle for 5 seconds, then relax for double the time, 10 seconds. Shrug your shoulders for 5 seconds, then relax. Then upper limb you tighten your all the muscles in the upper limb, 5 seconds. Then lower limb. So in between, tighten and relax So the entire body will become relaxed. Similarly, this breathing exercise. Deep breath and inhalation and exhalation. You concentrate on the movement of the. You keep your. I think that picture is there. Okay, so you keep your. This is called belly breathing. Keep your palm on your belly and you feel that movement of this called diaphragmatic breathing or belly breathing. If you take deep breath, the diaphragm will come down and your abdomen may protrude for it will move forward. So feel that movement. So the diaphragmatic breathing will stimulate your vagus nerve and reduce your stress level, that autonomic arousal. So there are other techniques called square breathing. So do some practice of breathing exercise and muscle relaxation daily. As Deepasri said, 10 to 20 minutes per day is very useful. And yoga, 50 minutes yoga. This is a 50 minutes package recommended by NIMHANS recently. There is a research center in NIMHANS for yoga, used for anxiety, depression, and even chronic mental illness. They have developed packages. They have published in a book, especially during this COVID time, this yoga a technique to reduce the anxiety and all. This kind of trying to learn something new, artwork. This is a Madhubani art, this is a doodle art, something you learn, even music or art or craft or some. Actually, I did all the activities in my free time. Okay, life filled with things. So only 25%, that 1/4 said about that, positively said about the interest activities. These are activities in our campus by our medical students. With even some of the items are made by our patients admitted in the ward, in psychiatry ward, female ward, cloth bag, and these are the again made by patients with the help of medical students. Dr. Amog, who organized the program last time, is a house surgeon now. He was very active in the campus, and we organized the activities with his leadership in using the NSS. We distributed all the saplings, and so you place the green this plant inside your room. It will reduce your stress. There are studies on creating or this dry wood and all. So this is a task we can do as a homework. This is called double circle questions. You draw a circle and write your skill or competencies or success inside it, inside the circle, and in the outside circle you have to write the what are the goals. So as a doctor, we are looking for a post-graduation. After MBBS, you will be looking for a post-graduation or a teaching post in the medical college to serve the nation, for patients, or going abroad, and also all the goals will be there. So it connect with your strength and goals and think how can we reach. So this this slide is just to show. This is called Vaitaba. The way you think about will bring out. If you think positively, there will be changes in the brain. Your brain will work for that, and there will be tracking. There will be neuronal tracks which will do something to reach there. So always dream for a better future, and you think about your goal. And so these are some activities we do in schools, and this is from a high school, residential school girls. So these are their skills, and these. So she wants to become an IPS officer, sports person. So a link with their current skills to this goal. So then what to do now? How to move forward? So like that, you can discuss your own thoughts. You can modify based on that. This is my wife. We work in schools, go to government schools, and we draw this picture this is in Malayalam. We draw in the blackboard. So what are your skills? Ask them to write on a white paper. Their class teacher also sitting here. They discuss their expectation, openly discuss their dream and all. It's a good activity you can do in your classrooms and all. So this is okay. Time is done.
Yes, so very sorry
Okay.
to proceed to the Q&A session.
Okay. So this is called a future-oriented questions. So think about your future. What are your hope? What are the resources helping you available? Think about your dream and what are the success stories or then scaling questions. So this we have discussed. Okay, then this is just repetition and coping with stress. This pandemic will be transient. It will disappear. This is another activity called the cherish moments in your life. This is called happiness jar. So what are the activities which will help you be happy? So things which are unhealthy coping, I have to mention about this. We have discussed alcohol, smoking. This will affect the COVID outcome also. These are all again unhealthy, like overeating, obesity will be the result of that. Angry and taking risky lifestyle. So you have to think about this healthy diet. Half of your plate should be vegetables and fruits. Okay. So this is the 10th point is you have to plan or be part of something bigger. So for example, feminism or this person, environment. So these are some activities we do in your campus with the help of NSS. So the 10 activities. These are the 10 activities. Finally, we recommend for our school students. The 0 means no abuse, 1 hour play, 2 to 3 hours self-study, 4 part your my plate with your family. The 6 a.m. bed and 7 to 8 hours sleep. That cloud 9 means meditation for nearly 9 to 90 minutes and 10 p.m. to sleep. So we give them a scoring sheet and they should be in 7 to 10. That's a green zone. This is the one we recently published. They can monitor daily. This is a monthly program. So summary. So we discussed importance of well-being and happiness in your life. And there are 10 points using that great dream. This is an acronym and 10 daily activities which you can plan in your, these are the 10 things we have discussed. So thank you. I congratulate the organizers for this program and I will stop sharing and try to answer questions. Sorry for exceeding time.
Thank you, sir.
Okay.
So, sir, if we have to sum up exactly what you said, so I think it would be follow a routine and maybe keep a plant in your room and get as much sunshine as you can in a day. And basically try to follow those relaxation exercises and yoga and meditation. So, coming to the questions. First question is, me being a medical student and someone who wants to pursue psychiatry, I find it really hard to talk about my own struggles with depression and dermatillomania. How can I overcome this?
So psychiatry, as I said earlier, it should be considered as a science. Previously, there was a lot of stigma associated with psychiatry, and in our state also there will be only few seats. Now in our department, previously it was only 1 seat. Now there are 12 seats for MD seats. No, the MD seats have increased, so there is a lot of opportunity. There are national institutes, NIMHANS, CMC, or PJ Chandigarh, Jimmer. There are very good institutes to learn a latest scientific, a multidisciplinary kind of, along with the neurology, neurosurgery, you can learn psychiatry. So, lot of research, not at all is taking blame. Yeah. So
the question is that if I have my own internal struggles with depression, then how do I become a good psychiatrist to offer solutions to someone else?
Yeah, that actually depression is also biological. We have to communicate and take solution for that, take treatment, whatever way, maybe mild depression, only psychological, psychotherapy and all. Severe depression, you have to take antidepressant, because depression is due to the imbalance of neurotransmitters, serotonin. So you have to improve the serotonin level. Very similar to diabetes mellitus. We increase insulin or other metabolic derangement by drugs. Along with that, you have to do exercise and diet. So we should consider depression also part of something like a medical illness and treat it and overcome it. And then you will be in a better position to help others, because you know the struggle, the suffering. Others may not understand that. So you'll be a better psychiatrist after going through survivors. Yeah.
So we have to treat it just like any other medical
condition. Any other illness. And you have to communicate also.
Yes, sir. So the next question is, I have been prescribed antidepressants earlier, but I'm always hesitant about taking them since we've learned about them in pharmacology and their side effects. So I know that the medications will help me, but I still feel anxious about taking them. How can I tackle this issue?
Antidepressant, as I said earlier, the severe depression, there is imbalance in the chemical, there is a biological illness. That is why there is a sleep disturbance and lack of motivation, loss of appetite. So biological problems should be handled biologically. So we have to correct that underlying pathology. That is depression is due to imbalance in serotonin and norepinephrine, that molecule level. So for that we have to take antidepressant, but it may take more time. So whenever there is an effect, there may be some few side effects. But after the long clinical trials, the safest drugs are now marketed. SSRIs are there. Different options are there. A lot of alternatives are there. If one drug is not effective, one drug is with some side effects, we can switch on over to another one. It's a safer drugs are there, but monitoring is important. Many medical students, even doctors, are on medication and they are performing well. But the major risk for depression is the suicide and negative thoughts, and it will impair our performance and all. So you have to openly discuss, seek help, and it is not a negative thing to get depressed, but it is unless you take a solution and move forward, that will be a negative attitude. So my advice is communicate, seek help, overcome it, and perform better.
Yes, sir. So biological problems have to be treated biologically, and like sir said, taking the help is more important. So depression is not something that is negative. Please take help. And so how to overcome inferiority complex, how to increase self-confidence, and what are the ways to boost our concentration and memory power?
Yeah. Small groups, usually certain personality may be anxious, avoidant, low self-esteem. That may be biological, a trait from our parents, maybe environmental because of the early childhood experience. But that is why I said you need not look into the problem or what are the cause, searching for the cause. We have to look forward. First, you have to think about what change you want to make in your life. We want to be more confident, more open, or we need to interact with more people and perform in front of others. So you can just score from 1 to 10, as I asked Deepasri earlier. From 1 to 10, where do you stand your score for a confidence? Not to score your low self-esteem. The other side, score the positive side, your confidence. It may be 2 or 3. Still, how can we improve from 3 to 4? So what small change, small activity you take? Something like talking to a friend, moving in a small group, or you may be able to learn something new, some skills, the 10 activities I said. So you have to identify, look into yourself and look your own skills. Positive things happened in your life. That's why there are many positive things in our life. You are intelligent, your family is supportive, you are studying in a medical, I hope you are in a good medical college, there are supporting teachers, there are many good things in life. So use that resources and move forward using the your own strength. So improve your strength, and you can use that if there is severe anxiety, that practicing yoga, meditation, simple breathing exercise, muscle relaxation, that will help. If you are unable to handle yourself, seek help from a professional. For example, a psychologist. She will help you. There are techniques called CBT, cognitive behavior therapy, which will correct that negative cognitions and improve the when there is a negative cognition, it will produce negative mood. If you can alter with a positive thought, it will produce a positive emotions and your behavior will become positive. So that's called CBT. So that will be, you can seek for that from a qualified psychologist.
Right, sir. So focus on the positives and seek support. So the next question is how to overcome intrusive and unnecessary thoughts that would lead to depression.
Yeah, actually these negative thoughts are not leading to depression. Depression, you must be aware that depression, we usually use it's a layman term. When you talk about depression, the major depression is something called biological depression. It can be mild, moderate, or severe. So there may be psychological causes, social causes, and the biological causes. Biology, biopsychosocial, that is a model we use. Biological is the changes in the brain, but the psychological, our own personality, the way we think is also important. Then the social factors, maybe it's an immediate stress or stressful events in the life. So all these are important. So negative thought alone may not lead to depression, but if some people, there is a negative way of thinking, those people will get help from these kind of CBT kind of techniques, like negative, how can we replace it with a positive thought. So always you look inside for your own strength and look for the resources available and move forward. So that's a 3 points you have to do. So first you look what change you want to make in your life. So what are your strengths? So what are the resources available? Who are all there to help you? So there are friends or your teachers, or sometimes you need a professional, and some techniques, something self-management techniques like breathing or yoga. If you're unable to manage, seek help, and avoid distractions like media, the TV, access TV or mobile use and all. Okay.
Yes, sir. So one last question. So how do we keep up the motivation to study on a daily basis?
Yeah, okay. As a medical student, you are all very intelligent. That's why you got selection after a difficult entrance test and you came here. But this topics are a little difficult, or syllabus may be difficult. For example, for certain people, biochemistry may be very difficult in the first year. So the micro, patho, so certain people it is very easy also. So depending on our brain, different areas and different talents, there may be certain topics may be boring and certain topics may be more interesting. So whatever whether interesting or not, we have to learn as a basic minimum to help others for patients. So it is better to connect with the relevance. Why should I study? The importance of how can we help a patient because of this learning process. We usually teach a technique called SQ3R. S means survey. Whatever you are going to study, you just survey the topic. You see the titles, see the pictures. So just survey. We will get a holistic picture about the thing. Then Q means the questions. So what are the possible questions from this topic, or what are they in the previous university exam? You just try to identify the questions asked from this area. So and what how this will help you in your as a doctor, as a clinician. How can we help a patient for learning the liver will help you patient with hepatitis or alcoholic issues and all. So that, or drug-induced hepatic issues, all these disorders. So that will be very important or interesting for us, correlating with a clinical scenario, a patient helping a patient. So survey, then ask for questions, whether it is theoretical or a practical. Then R. R means reading. R. Reading. If you are less interested or losing concentration and all, read aloud. Read aloud means the learning will take from visual learning, auditory learning, and tactile learning. So read aloud and write notes. So these notes, small notes, will help you in your post-graduation also. You'll be able to refer, come back, and your own notes with the diagrams, highlighting and draw some, making some short forms or acronyms. It will help you. So always make small notes. It will help in your future PG entrance also. And in the final exam, you may not be able to revise all the big textbook, but these notes will help you. So the read aloud and write, that is the first R. Second, close the book and recite. Just try to remember the 5 points you are written down, or you read in that passage or the book, or discuss with your friends, or try to teach your friend. So that teaching is the best way to learn. So if you are in a hostel, a group learning may be a better one. So read, recite. Recite means recollect or remember. The third one is revision. Revision is most important for our brain. It is something like a brain gym. So memory is the immediate memory will be in the cortex. The hippocampus, you have to store for a long period. So that needs some internal processing, and repetition is very important to deposit in your hippocampus and take it whenever you are whenever it is required during your exam or oral. So repetition every week, towards the weekend, you try to revise whatever you have studied in that. You just go through the notes, and within 24 hours, try to go through that notes again. So these are simple ways we usually train. SQ3R. to improve the concentration, studies, and all. And the key motivation should come from inside. When there is a goal, and it can be short-term goal and long-term goal. When you are feeling bored, think about the long-term goal, become a doctor and working in a medical college or teaching others and helping others. And think about, so the 10 techniques we have discussed, do some hobby, interact with the friends. So never go for negative behavior.
Right. Yes, sir. SQ3R and keep your goals in sight. Thank you so much, sir, for being part of the webinar. So thank you for providing your insights and for your guidance. On behalf of the South Indian Medical Students Association, I would like to sincerely thank you for the time, for giving us your precious time. Thank you so much, sir.
Yeah, this is, the pets are very good for relaxation and
yes, sir, I totally agree.
Yeah. He is taking care of our COVID difficult time. Oh, thank you very much for the opportunity.
Thank you, sir.
Yeah, discussing this mental health is always a pleasure for us. And so thank you. See you.
Thank you, sir. Yeah. Thank you so much. So now Manan from MMCRI will talk about effective time management, and we have a great list of time management skills and tips and tricks that all of you guys can include in your studies. So stay on.
Good evening, folks. My name is Manan, and I'm a student of Mysore Medical College. If we read this comic, we'll find that it's truly relatable to the instances when we sit down to study and get distracted by petty stuff like Instagram posts or web series. And this becomes the reason for a procrastination and improper time management. So the topic of my discussion is how to effectively utilize the time that we have. As I was researching for this presentation, I came across this Parkinson's law, which states that work expands so as to fill the time available for its completion. In simpler words, I can explain it in this way. How much ever time we dedicate to a task, we end up using all the time for it. To understand it further, we can take a scenario when our teacher announces an exam 1 month prior to its commencement. The students approach the preparation in 3 different ways. The first group studies just 1 week prior to the exam, and the other 3 weeks are wasted. But yet they end up excelling with flying colors. The second group is hardworking, but inefficiently studies for 1 month. The third group is also hardworking and refers to extra guides and resources, which are not really tested in the exam. So what we see here, that the students needed only 1 week of study time instead of the 1 month they invested. So how to use the Parkinson's law to our advantage? The first thing, we while making a timetable or while planning for exams, we should allocate the time required for the task reasonably. It shouldn't be too less, nor too much. And we should keep in mind that we shouldn't compromise on the quality. Then the second thing is that we should set deadlines, and they should be pressurizing enough that we finish the task within time. The third most important thing is that as we complete the task, we should analyze how much time the work took. It could have taken more or less. And this exercise would help us to plan better in future. So the second best habit we can adopt is maintaining a to-do list. Every day as we work and study, at the end of the day, we get a ton of tasks piled up in an unconscious mind, and we either tend to forget them or get stressed out. A to-do list basically helps us not to forget any of the tasks and also helps us to prioritize them in order of highest to lowest importance. A to-do list also helps us to set daily goals. I personally suggest you all to use mobile-based apps like Microsoft To Do and Google Keep, since they help us to systematically create our lists and also access them anywhere without carrying the conventional paper-based lists everywhere. We should also keep in mind that as we complete our tasks on the list, we should take short breaks to re-energize ourselves and introspect about our efficiency and quality of work. If you're really distractible and find it too hard to focus on studies, then I would like to suggest the Pomodoro method. So this is how this method goes. You can choose any plan listed down here. Let's suppose we take the second plan, which is the Pomodoro plan. This plan says that you have to study for 25 minutes with full concentration and then take 5 minutes break. You have to follow the cycle of 25 plus 5 minutes 4 times. It means that you follow it every time you take you start studying for 25 minutes after taking a 5 minute break every time. And then you'll gradually you'll gradually feel that your concentration level has increased and you're able to bring out more productivity. And if you feel that your 25 minutes is way too less to study, then you can shift to the other plans like the golden plan, which says that you should focus for 15 minutes and then take 15 minutes, or the busy plan, which says that you should focus for 90 minutes and then take a break for 30 minutes. To stay motivated, we should make use of the reward system which exists in our brain. So whenever we accomplish a task and get rewarded for it, our brain reward system gets turned on. That causes the feeling of pleasure. Our brain remembers the action responsible for achieving the reward and urges us to perform the activity. In a student's life, the activity could be studies, and the rewards could be long-term rewards like good grades, scholarships, planning a vacation after the exams, or expecting a letter of recommendation from HODs. I personally feel that short-term rewards are better for your process of learning since they keep you motivated. The short-term rewards could be your favorite food, or listening to music, or even playing a game with your friends. Now we have come to the last segment of my presentation, which is how does exercise help us in being productive? So exercise helps in increasing the cardiac output, which leads to more blood flow to the brain. This in turn promotes the development of vital centers of learning in our brain, which improves the cognition and memory. Exercising also raises endorphin and serotonin levels in our brain, which helps us to reduce your stress levels and improve your mood. Last but not the least, experts have also found out that exercising helps in increasing your energy levels. So the logic is simple. The more the aerobic exercise you perform, it leads to more production of mitochondria for meeting the energy demands of your body. And thank you. And now over to Snigdha.
Okay, hi guys. My name is Snigdha and I'm currently a student at MMCRI. I'll be talking about study tips, but I won't really go into very specific tips. I'll be talking about generalized ideas that may help some of you who are still listening. Next slide, please. Right, okay. I'll start off by talking about a study that was done by Dalnowski. He is a psychology professor. And what these guys did is they went over a ton of research that has been done over the last 100 years. And they looked at 10 different revision techniques. And here is part of what they concluded. They said that highlighting the so-called important points or making notes of read or going back and reading the material again are possibly one of the worst ways that you can revise something, which is quite shocking because most of us have been doing this or will still do this after this session. But as the evidence shows, you could be doing things much more efficiently. I'll talk about what he said is efficient in the next two slides. Right. Okay. So the first idea that he talks about is the idea of active recall. I'll be reading that pink column that's in the center. So recall is better than recognition. While learning something, retrieval of information from your mind is much more effective than putting information back in. So it seems, or at least that's what the evidence tells us, that extraction of information from your mind is much more effective than doing those last three methods that we just talked about, the highlighting, rereading, and summarizing thing. Um, and the cool thing about active recall is you don't really need an elaborate plan to implement any of this. Like it could be as simple as reading a page from your textbook, closing the textbook, and saying out loud whatever you just read, or writing it down, or explaining it to someone. What Dalnowski talked about, and it was heavily emphasized in his paper, he said that testing yourself is the best revision technique. um, this doesn't have to be like a formal test. Obviously, you could be using standardized tests, but you could also come up with your own questions and then answer them. Um, Another thing about active recall, so we have enough evidence that it does work, but we don't have enough evidence as to why it works. I'll be talking about one of the theories. So um, we've classified memory into three sections. Um, the first one being working memory, the second being short-term memory, and the last one being long-term memory. So as students, our goal should be to transfer everything in our working memory to long-term memory. And it seems that active recall accelerates that process. Something about the fact that it strengthens the connections in your brain. I'll be talking about the second idea in the next slide. Right. Okay. The second idea is much more obvious than the active recall thing. So this has happened to everyone here, but you read a page of the textbook, and then the next day it feels as if you haven't read the textbook at all, or even if you do remember reading it, you can't really recall all of it. And this is exactly what the forgetting curve is representing. It's the idea that information is lost exponentially from your brain, given that you're not making active efforts to retain the information. It almost looks like the radioactive decay graph. Um, and the more you look at it, it looks as if bits of information are just like leaking out of your brain constantly. But the very idea of spaced repetition is to look at something or to study something, ideally by active recall, such that you're destroying the idea of the forgetting curve, or you're making it such that it takes you infinite time to forget something. I'll be explaining the white color graph here. So say day zero is the day you study something for the first time. And ideally, you know 100% of whatever you just studied. Um, so the next day you wake up and now you remember 80% of what you just read. So the so-called loss of information is 20%, and that took one day. But by using spaced repetition, ideally you would go back and on day one you would read the same thing again, and now you're back to 100%. But it seems, or as we can clearly see, this 100% isn't the same as the first 100%. It will now take you 2 days to come back to 80%. And the more you kind of use spaced repetition, integrated with the active recall thing, the longer it will take you to forget something. Right. Okay. Anki. So this is the main reason why we're even having this segment. We were like genuinely shocked as to how many people don't know about this app. It's a digital flashcard app, and it works on these two principles that we just talked about: active recall and spaced repetition. Um, It's free on Android, but it's paid on iOS. So I guess you guys have to use the web version unless you're willing to pay like 3,000 for an app. So yeah, this is how a card looks like. A card has a front and a card has a back. So the front portion of the card is the one on the left, and the back portion of the card is the one on the right. I'll go over these things right now. So the front portion, we have a question. The question here is, amino acids are found in protein, and you would go over the answers in, and you have the answer, you click on the show button, show answer button, which is at the bottom of the screen. And the app will then take you to the back of the card. Here's how the back of the card looks, and you have the answer there. Only L amino acids are found in proteins. Here's where it gets like very cool. So, okay. Hello.
Snigdha, can you mention about the decks?
Yeah. Wait, I didn't get to finish. Like, can you go back to the slide?
Yeah, I'm sorry. Continue.
Yeah, right. I think my audio got cut off or something, but I was talking about the back of the card. So you have the answer there, and here's where things get kind of cool. So you get to give the app your own inputs. So say you could instantly recall that answer. You click on the easy button, the blue color button, and you get to see the card again in exactly 4 days. But if you had some trouble recalling the answer, you click on the middle green button and you get to see the card again in less than 10 minutes. Say you couldn't recall the answer at all, the app will show you the card again in less than 1 minute. And the more you sort of use this app, the more it learns from your behavior and can tell exactly which kind of cards you're messing up and which kind of cards you're good at. So the cool thing about Anki is that it's integrating the very idea of active recall and spaced repetition. So you actively recalled the answer to this question, and the app automatically is integrating spaced repetition by showing you the cards at regular intervals. I do want to mention the fact that Anki is very uncomfortable to use, especially when you're just starting out. It takes some time to sort of get used to the software and get used to putting so much pressure on your brain, because this might be the first time you're using this method. Another thing is, when you're starting out, please don't make your own cards. It gets very messy. You either end up with too many cards or you end up with cards that aren't enough. There are like a ton of YouTube videos talking about Anki, so maybe check that out before downloading. The last thing about Anki is it's mainly for memorizing very specific information, or it's mainly for memorizing data that you might need to know. But what do you do if you want to look at the overview of a concept, or you want to look at the broad idea of how something works? You can't really use flashcards for that. So for that, I'll be talking about two methods very briefly in the next two slides. Right. The first method is to make mind maps. I'm sure all of you know what a mind map is. But to integrate making mind maps with active recall could be quite a powerful combination. I won't go into any detail because there are like a ton of people talking about mind maps online and how to like optimize them and make them look all pretty with colors and stuff. The next idea which I could go into a little bit more detail. Right. So it's the Cornell note-taking method. I personally haven't used this, but I do know people who have, and it's worked for them. Basically, you're dividing the page into 3 sections. The one on the left is any questions that you may have, or any questions that you've come up with, and stuff that you keep forgetting. And the one on the right is the main content of whatever you're learning. And the bottommost column or row is the summary of whatever you've learned. Right. So I'd like to end my presentation here. I really hope all of you download Anki. Thank you.
Thank you, Snigdha, for those tips. I'm sure it'll be helpful for all the students who are listening in. So moving on, MedBound, it's a global community for medical and healthcare students and professionals. You can share your opinion and perspective on medicine, health, and the life around it. So it follows the concept of each one, teach one. Do check out their website. I'm pretty sure you won't be disappointed. So MedBound, it supports a free teaching tool for medical teachers that can aid in disseminating information and knowledge with medical students and professionals across various kinds of medical systems. So we, the students of SIMSA Karnataka, have in association with MedBound, we've come up with a photography contest, which is called Utopia. So the details of which will be shared in the WhatsApp group. The deadline has been extended till 16 July. Do not forget to send your entries in. The prizes will be as listed as Amazon gift vouchers. So thank you all for joining us today. I really hope it has been a helpful and beneficial session for you guys. So we, the students of SIMSA MMCRI Karnataka, really thank you all for being here. And also thank you, Pooja, for guiding us and supporting us. Without you, this wouldn't have been possible. So thank you and have a great evening. And thank you, sir, and Dr. Anilkumar, sir, for sharing your insights and tips.